Dr. Rajendran, they met up with Dr.Sree, who had also flown to Bangkok from Mumbai. He shared some very interesting information about herbs that he uses for detoxification.
In detoxification, I have to say we do cellular detox, we do colon detox, we do renal detox, hepatic detox, and rectal. So we have 5 components of detoxification, which we combine modern allopathic system with traditional Ayurvedic system.
So do you have traditional herbs that you use when you say Ayurvedic system? Do you have traditional herbs? What herbs might you use for detox?
In treatment, we use a lot of curcumin, ashwagandha.
Ashwagandha?
Yeah.
Okay.
Dacopa.
Okay.
And also we use a lot of, now because it is quite common there, it is moringa. Moringa we do quite a lot. And in our part of the world, it is the coconut. We use a lot of virgin coconut oil, and it is fresh we get. And a lot of, we can say a coconut detoxification we do. We're using a lot of coconut water and coconut chunks and flesh and all these things we use especially for detoxification.
Talk about that. How could you use coconut to detoxify?
Yeah, one of the most important thing, if first thing, okay, if I have to use coconut too much, I have to look at the kidney function. If the kidney function is good, I will definitely go for a coconut keto. And I have a lot of clients, patients who came down from US, and I also put them on coconut. They love it because coconut is naturally it is there, plenty, so you get from the fresh. And start with water, then we give coconut milk, and then we start giving virgin coconut oil, and we give salad dressings in oil, coconut oil, and all these things. So they will get tuned with that, and then we can we'll switch over to the when you go to the high ketogenic diet, we give up to 60 to 100 ml per day of virgin coconut oil.
Okay.
And we also give good amount of coconut water, because that is one of the best product for it's a diuretic. So plenty of urine passes, so it is
helps to detoxify the kidneys. Okay.
So that is some people come and ask me about pure coconut detox. They come for coconut detox. We can say it's a coconut detox, which especially our name of the state is called Kerala. Kerala means coconut, the land of coconut.
Kerala, land of coconut. So you have plenty there.
Yeah.
I then asked Dr. Sree Kumar about his advice regarding electromagnetic frequencies and dirty electricity.
What I tell, okay, as far as possible, avoid exposure in the bedroom. All these types of television, Wi-Fi, mobile, computer, use in the living room. Don't take it to the bedroom. And bedroom, the light also, CFL lamp, LED lights, take off. And traditional old yellow bulbs and all these things, maybe if you want. You don't require any much light in the bedroom. So in the living room. So then you can, what I normally give is, I give too much of zinc and magnesium.
Zinc and magnesium.
Oh, that will produce great amount of melatonin in the night. Because
Really? That produces melatonin?
Yeah, indeed. In every step of melatonin production, you need that zinc and magnesium is required. Zinc is required for magnesium absorption, and magnesium is required for the final stages of transition onto the melatonin production.
Wow. Good advice. So you said you give, one of the things that you're concerned with is the dirty electricity. Can you discuss how that might be increasing the rates of cancer?
One of the thing is it produces increased production of insulin in the human body. If you are exposed, I have done a few patients on trial, because some people initially used to challenge me. No, it's not like that. Because I challenge this with the doctors. I say, okay, do your blood test. You expose yourself to 1 hour in front of the computer. Then go and check your blood sugar and blood insulin. I have seen all the insulin levels are high and blood sugar may be normal. So that means insulin is shooting up. Insulin will, when insulin shoots up in the night, it will increase your cortisol level. Then it will suppress your melatonin level. So the cortisol melatonin ratios will work there, and melatonin production is suppressed here. And if it goes on for days, months and years, it may produce an organ damage, maybe cancer, maybe even you call it brain diabetes, you call it as Alzheimer's disease.
The latest study to look at the effects of blood sugar levels on the brain has found that high glucose concentrations can lead to an increase of beta amyloid plaques and tau tangles, suggesting that Alzheimer's disease may actually be a third form of diabetes. And there are multiple other studies that indicate the same thing. Again, sugar is a huge problem with both diabetes and cancer. I asked Dr. Sree about his suggestions for food.
I will say it should be natural. It should be local.
Natural and local.
Because any vegetable that is growing here in Bangkok, without any help, it has got all the power to resist all the toxins of this atmosphere. If you can consume it, that can protect you.
Wow, I've never really thought about it in that way, but he's right, isn't he? The plants that are thriving have immune systems that protect them, so if you consume them, then they protect you. We're going to hear an inspiring testimonial now from one of Dr. Sree patients named Dinesh Varrier, a former smoker who was diagnosed with squamous cell carcinoma and underwent radiation therapy.
Then what happened after about a week of radiation, slowly the the burning on the skin and the peeling off and all that started, losing my hair in these part, and deformation all started. Still, we went through the radiation without much of a hitch. But then the recovery was more important because all these, and I lost weight. Then I started slowly taking IV, vitamin C. Under the advice of Dr.Sree, I was taking care of my intake properly through his advice. Typically very nutritious food, increasing the protein content, increasing the vitamin content. Even C intake was increased. And then after about a month or two, I could recover, and all my skin started growing back. And then for 3-4 months, I was not advised to take any exercise. But after that, again, with permission from Dr. Sree, I slowly started my small time, started with stretch exercise and slowly increased it. Now I have a sort of very, very structured regime of workout. I do about 45 to 50 minutes per day. I don't over exercise because that is not advised. And I'm feeling very, very comfortable. And if you ask me, except for that radiation damage, which was more of the power of the radiation, the damage caused by that rather than the disease. And my recovery was more in terms of recouping from that bad effect of the radiation. But now I'm feeling quite comfortable, feel extremely healthy. Touch wood, I hope it should continue. Thank you.
Thank you, Dinesh, for sharing. Now, I next asked Dr. Sree, what exactly is cancer?
Most of us are blind in what is cancer. Is it a disease or is it something else? I'll explain to them that this is nothing. It is not a disease to kill you. It is a signal to make you more stronger. You have to instill hope. Hope will liberate some neurotransmitters. Then you have to support it. When you want to support it, that means your mind starts believing you. So hope turns into the belief, and belief will destroy any disease.
How true, the power of belief. Building upon the foundation of positive emotions and beliefs